Hey everyone, how you doing? Dr. Dan here, Ozark MMJ Cards. Listen, I have a really exciting, awesome, cool study that I wanted to share with you guys because sharing and disseminating cannabis wellness information is really what I'm all about. And I find that when we can spread and share knowledge, that's how we can really dissolve stigma. And a lot of stigma going around even today surrounding cannabis. So I'll jump right into this study so we can just take a good look at it. I had a lot of anxiety about presenting this study. I just wanted to say that, really before we jump into it, because I know anytime you present another researcher's work, their work is usually credible, and I want to be able to present it credibly because they put a lot of work into this sort of thing and being able to get it published. So it took me a couple of false starts in doing this and twiddling my thumbs and drinking coffee and pacing around my place before getting it started. The first one that I did, I just told my editor, I'm like, throw it out. It's so crappy. So I'll try and do a good one this time. All right. We'll just jump right into the presentation. Folks, we have the COVID-19 Cannabis Health Study. This was done in 2020 and published in the Journal of Addictive Diseases. So basically, this was, you'll see here in the title, this was an epidemiologic assessment of adults who use medical cannabis in the United States. So first name author on this was Dr. Denise Vidot of the University of Miami. All right, Dr. Vidot is a tenured associate professor of epidemiology at the School of Nursing at the University of Miami Miller School of Medicine. Okay, so she's also great resume on this researcher. She's also founder of the Global Cannabis and Psychedelic Research Collaborative. So she's done this and published several other studies along in this vein, not just with cannabis, but with other psychedelics. And I think real interesting in her background, she also focuses on how the endocannabinoid system interconnects with the heart, brain, and gut axis. All right, super important, real treasure trove of good educational material there, because that falls right into my wheelhouse as well for just general wellness, and cannabis being just a good entry point. So why was this study important? Okay, why did they want to look at this particular study group? Well, let's start. So as you know, for states that have medical cannabis programs, usually the qualifying condition is having a chronic, pre-existing chronic condition. So when you survey this group of people with chronic conditions, this group that use cannabis and people that have chronic conditions, you're going to get some really, really valuable information, because this survey was done during the COVID pandemic. So we get a really good insight into the behavior of people who have chronic conditions and use cannabis. So why don't we just dig into this study, see what they asked, and see the sort of answers and information that they were able to get when they sent this survey out to these respondents back in 2020. Let's jump into it. Okay, folks, where did they get this sample population from when they were doing this COVID-19 medical cannabis user study? Okay, so they sent out an electronic questionnaire via social media, and what they got was anonymous respondents who were not compensated for their response. I'll get back into why that's important with respect to a non-biased study. But when you have an anonymous, non-compensated study, you're going to get true answers. So I just wanted to throw that out there. So what they got was 1,202 respondents. And what they did after they got these respondents, they wanted to make sure that they were getting true medical cannabis users. So what they did was they asked, have you used cannabis in the last 30 days? All right. And those who said yes, they included in the group, and they tried to include people who affirmed, yes, I use it for medicinal purposes. All right. So those were the people that were included in the study, and they threw out all of the duplicated responses. Excuse me. They threw out responses that were duplicates, bot responses, that sort of thing. All right. And what they did after they got these responses, they looked at the demographic characteristics, which you'll find here in the table. So, what do you get when you look at the demographics of people who affirm that they're using medical cannabis, people who have used cannabis for medical uses in the last 30 days? So, age, we get an average age of 47. You got 1,202 responses here. All right, 1,200 people. 1,202 responses on this survey. Average age was 47 years old, 52% male, all right? 82.5% white, non-Hispanic, all right? In terms of education, you have 70.1% with some college or bachelor's degree. In terms of income, what does the medical cannabis user look like? About a third of the respondents made 50 grand or less. All right. So, sort of a normal distribution in terms of the income there. Important info here, 13% veteran status for medical cannabis users. Employment, big issue here. Unemployed prior to the pandemic, 8%. Unemployed due to the pandemic, 13%. 21% unemployment in this sample group, which tracks a whole lot with what we saw during the pandemic, record unemployment. Okay. So, as far as having chronic conditions, 71% of the respondents have at least one chronic condition. As I stated before, 65% of the sample population affirmed that they had a mental health condition that they were managing, and another 44% were managing pain. So, mental health and chronic pain, the top two managed conditions when you're talking about the medical cannabis group. So we get a good snapshot here of the avatar of what the medical cannabis user looks like, at least as far as this study goes. Okay. So let's take a look now into their cannabis use. That was one of the main things that they were looking at when they're looking at this study. So here's the part that I really look forward to presenting, folks. You know, this is the table that goes over the medical cannabis patients' cannabis use and how it changed with response to the pandemic. So I got some really great info here. All right. So I'm going to jump around a little bit because some info I find more important on this table than others. So you see me kind of go out of order here. All right. So I wanted to jump into the cannabis delivery. Which method of cannabis delivery do you use the most? This is before COVID-19. All right. So the great preponderance of people smoked in a pipe or bowl. Number one, 36.3. Vaping coming in second at 28%. Smoking in a joint at 18%. Blunts, 6%. Yucky. Tobacco, yucky. All right. So you can see the great majority in inhalation. All right. Very much the majority here. Okay. Edibles, 6%. Tincture at 4%. Pill at 1%. All right. So you see the non-inhaled options here prior to cannabis. Prior to cannabis. Non-inhaled options here prior to COVID, much less popular. All right. Then you see since COVID, after COVID, we'll see this again. Better to look at this in the graph. You see the edibles went up here. Went up to 31%. All right. And you see that the smoked and inhaled methods all went down. Let's look at it here in the graph. Easier to visualize here in the graph. All right. So here's the inhaled ones here. Bowl, pipe, blunt, joint. Okay. You'll see before COVID-19 here in the black line, dark gray after COVID-19. So these are all inhaled here. Here's vaporizer over here. Down, bowl or pipe down from 36 to 19. This is the most popular one, bowl or pipe. Before COVID, 36. After COVID, 19%. Blunt, yucky, 6% down to 1.4. That makes me happy. Joint, down from 18.6 to 12.7. Joint, my personal favorite. Anyway, vaporizer, down from 26.8% to 20.5. Here's the money part right here. Edible, 7.3, up to 31.8% after COVID-19. Okay, you see tincture and pill, both went up there. But edibles went up. All the inhale went down. Edible went up. Presumably people thinking about increased susceptibility with inhalation, causing lung pathology. So they went towards the non-inhaled version here. And you'll see this reflected kind of in the numbers here. You'll see me scrolling up here. Here's where we talk about method of cannabis use changing. Okay, since COVID-19 was declared a pandemic, has the method that you use cannabis changed? 16%. Okay, that's where you see those changes in those lines there. All right. So here, going back up, how's your dose of medical cannabis changed? 38.4% increase the dose, 48% no change. All right, 8.8% decrease their dose. So 38% increasing their dose. All right. So dominant cannabinoid, not surprising. 60% THC dominant, 26% look for a ratio. CBD, not as popular, 3%. Not surprising. Worry about being able to pay for your cannabis? Split right down the middle, 47%, half and half. Okay. Half not worried about paying for their cannabis, half worried about paying for their cannabis. Advanced supply of your medical cannabis since COVID-19 started, split down the middle, 47%. Half worried about half people getting an advanced supply, half not getting an advanced supply. For those that did get an advanced supply, you sort of see the numbers kind of all over the place. 25% get a 2-week supply or less. 28% getting a 1-month supply. So with vaping, do you share electronic vaping devices since COVID-19? No, 60%. All right. When you go to the smokables, do you share joints, blunts, or spliffs? Prior to COVID-19, before COVID-19, 42% solo smokers. All right. That's at baseline. All right. After COVID-19 started, 37% stopped sharing smokables, joints, blunts, or spliffs. 9% decreased. All right. So you're looking at about 45%, 46% who either decreased or stopped sharing the smokables. Right. So you did see some behavioral change there. All right. So how much were you high? For 6 or more hours, influence of psychoactive cannabis, 6 or more hours. Daily, 65%. So the COVID-19 portion of this part here, folks, I'll try not to be biased here, all right? But I was pretty underwhelmed by the results here, okay? And I'll get into that in a little second. But as far as being symptomatic for COVID-19, 7% affirmed that they had COVID-19 symptoms. Okay. Remember, this was back in 2020. They gathered this information. They sent out this survey between March 21 and April 23 of 2020. All right. And they had 1,202 respondents. Okay. 7% affirmed during that time that they had COVID-19 symptoms. All right. And 2.1% of them got tested for COVID-19. All right. So you see a little delta there. 7% with symptoms, but only 2.1% got tested. All right. Of those, that's 25 people out of the 1,202. All right. 2.1% got tested. Testing positive for COVID-19, a grand total of one person, one positive test out of 1,200 people in this study. All right. So that's a 0.1% prevalence, positivity prevalence for that whole study. Now, that's not a true prevalence. That's just prevalence based on those tested. Okay. So there's the numbers really for COVID. Not really a whole lot to tell, you know, as far as the numbers, testing and that sort of thing with COVID-19. Sweet. So that's pretty much the study, folks, what they got as far as the questions that they asked and the information that they were able to get from this COVID-19 medical cannabis user health study. All right. So really, what were we able to glean from this? All right. What conclusions did they come to that we're able to share and disseminate with the cannabis community? All right. Because we got some really, really valuable insights here from looking at this information and looking at this really, really important group of people with chronic conditions who also use medical cannabis. All right. And I think one of the really valuable things that we get from this is we're able to open the conversation with this population in a really, really non-judgmental way, whereas before there was so much stigma surrounding these people. All right, and we're able to get a whole lot of insight with respect to their behavior. When you look at the population of people who are managing mental health, anxiety, and depression with cannabis, we were able to see from here that they had a much higher odds ratio versus people with other chronic conditions, other diagnoses. These people had a much higher odds ratio of an increase in cannabis use versus other people. Those with mental health conditions had highest odds of self-reported increased medical cannabis use. This is helpful when we're going about counseling our patients and understanding our patient population and being able to understand what makes our community suffer the most, and we can acknowledge these things and alleviate community suffering because now we have better information, we have better knowledge, we've replaced stigma with knowledge. So at least from a healthcare practitioner standpoint, we're able to better serve our community and have them suffer less because we understand them better. All right. So that's a really, really positive thing there. Thank you very much, folks. Have a great and wonderful day and week, and we'll talk again soon. All right. Bye for now.